Welcome, everyone, and all of you fantastic listeners out there. Thank you so much for tuning in. Welcome to the Cherilyn Lee Health Show. And here's your host, the lovely, the fantastic Miss Cherilyn Lee.
Good morning, and thank you for joining us to the show today with my wonderful co-host, Belinda Foster. And I want to thank everyone for joining us today. We have a wonderful guest today. So you're with us today with wonderful, I'm going to let my co-host, she's going to tell you a little bit about our wonderful guest. And as everyone hopefully out there received our wonderful banners about the show, we're going to be speaking a little bit about phospholipids, but not just on the immune system, really for cardiovascular health. Okay, Belinda, take it over.
All right. Well, our guest today, and he is so fantastic. Let me tell you, he asked if we could refer to him as Arnold. I'm going to say it's Dr. Arnold Takemoto, and he's best known for working with and teaching doctors all over the world, from Japan, the United States, and Western Europe. Thank you so much, and welcome to the show.
Well, thank you very much, Belinda. I really enjoy speaking on Dr. Lee's show, and hopefully we'll be informative to your audience today.
Yes, we will. So, before we get started, Doctor, I would love for you to, a lot of people have called and I've received some text messages. I have a lot of patients on the product that has the phospholipid. But can you explain to our audience what is phospholipid?
Well, phospholipids, lipid means fat, but it's a good fat. And phospho is from phosphorus. So it's fats, plural, that contain phosphorus. And virtually all the phospholipids are very beneficial to your health. And you may not get enough in your diet, and that's why it's critical to enhance your diet with phospholipids. Unfortunately, they do not absorb well taken orally. So, in the past, with over 900 clinical studies, mostly done in Europe, it involves intravenous work. But there's been some recent new advances, of which the company that I have founded has developed a way of delivering phospholipids, especially the beneficial ones, orally. And that's so unique because normally if you take phospholipids, if you take enough, it can go into the colon and you have diarrhea for a couple days.
Yeah.
I know, I experimented on myself. So I had to develop a way to deliver it orally, intravenously. And that's the key.
Okay, and I know it's part of a product, and it has worked so well for people who cannot take vitamin C IVs and have it combined with the vitamin C. And the benefits of it, I want you to talk about also, because I've used it in my practice. I've known you, Dr. Takemoto, for a number of years, for greater than 20 years, and have seen incredible miraculous things change. One thing I want to say, I had someone tell me today that they're looking at some of the talk shows and people are getting into trouble because they're almost diagnosing and treating over the air and people are misinterpreting. And I'm so grateful that's what we don't do here. We don't do that here at Nutrimed or the Cherilyn Lee Health Show, so we're not giving any recommendations and everything. If you have a condition, you really want to seek out a doctor preferably an alternative doctor to find out exactly what's going on and be treated properly. I just want to kind of put that out there because that's kind of been floating around a lot of what's happening with a lot of radio health shows and with TV shows too. So I want to say, Dr. Takemoto, if you now can, because you're working with a lot of doctors with this product, and the benefits that are coming back. And not just saying benefits. These are lab test results, not just, a person saying, I'm feeling better. We see lab tests that are changing in the healing process. It's wonderful.
Well, absolutely. In fact, the product that has the two phospholipids in it is Ultra Absorbic C, which you mentioned, and also Detox Max Plus. And we've seen dramatic results. I know a doctor in Tokyo, Japan, said he would try the Detox Max, and he had a patient with full-blown dementia for 5 years. And I saw him at a medical conference about 3 months later, and he said, "I can't believe it, Arnold. She had a total reversal of her dementia," and that was 5 years out. And we've had, a doctor in Germany just was totally shocked when he had some cases of autism, learning disorders, and a major problem in Europe is young couples getting pregnant. And they use the Detox Max along with some other supplements, the Ultra Absorbic C, etc., and got phenomenal results. So he has a huge clinic now utilizing this oral form of phospholipids. And phospholipids are crucial to our well-being.
Yes, they are.
They are every cell in your body. That's trillions of cells have a double wall of phospholipids. And also in the brain, a major component of the brain tissue is phospholipids. So it is crucial. It's used in the synthesis of tendons and ligaments and numerous other major organs in our body. So I can't stress enough the importance of phospholipids. And properly absorbed into the bloodstream, it can also help lower cholesterol. And
yes.
I can talk about that, during this program a little bit later.
Okay. And I have a patient who went from a 300 to, he's now at 180. No, actually 170. 170, and lost
Wonderful.
weight and everything. So he's taken the full spectrum, and he's doing phenomenally. He's really doing well.
Well, we don't get enough phospholipids in our diet. It's found in small amounts in vegetables. The best source is soy, but it's important to get a very pure form of phospholipids, and the principal one being phosphatidylcholine, and a lesser importance, except for the brain tissue, is phosphatidylserine.
Yes.
And they're all part of the quote-unquote essential phospholipids, and the reason why they call it essential. And so can you imagine the trillions of cells in your body? You're not going to get optimum repair unless you get enough essential phospholipids in your diet. And the source is soy. Most people don't eat soy.
No.
And now the soy is polluted with a GMO process.
Yes.
So, that discourages even more people, and rightfully so. I personally would not drink anything but organic soy milk or organic soy products or organic tofu for that reason. So, we don't get enough in our diet. And you're not going to be getting these in a meat diet or a carbohydrate diet. So you may not heal properly. It can affect your immune system. And most of all, it affects your vascular system or blood vessel system, including, and most important, your heart arteries.
Yes.
And there has been over 900 published human studies, virtually all in Europe. So it's not well known in the United States, on the use of phospholipids to help, quote unquote, according to the studies, reverse heart disease, as you mentioned, lower blood pressure, to repair kidneys, and to repair damaged livers. And this is routinely done. It used to be done in Europe with an IV called Lipostabile. However, Lipostabile is not available in the United States now. The patents have run out, and the European pharmaceutical companies, I mean, what use is it to try to market it in the U.S.? So it's very difficult for a doctor to get, and it's quite expensive.
Right. You know, I had a patient that there was a doctor that I know that was using that with her, and she had MS.
Right.
With very good results. So now she's doing the oral form, and she's doing really good, a lot better than she was.
Well, some doctors are getting the Lipostabile or other forms, and they're extracting some blood, putting it in blood thinner, and reinfusing it back into the patient. And there is some dangers. I mean, it even clots in the blood draw tube.
Yeah, no, that's something I would never do myself. That's something we don't do here.
Absolutely.
No.
And I have gotten calls from their patients that, you know, because they know that a key part of ultra-absorbic C and Detox Max is very high amounts of phospholipids. And they even mentioned the problems that they had. So, and it's not approved therapy in the United States.
Right.
You know, where you're pulling the blood out and putting phospholipids in there and reinfusing it back into the body. Because whenever you pull blood out like that, there's a risk of blood clots.
Most definitely. And you don't want to play around with heparin, trying to, you know, heparinize it. Anyway, that's a topic for somebody else's show.
Yeah, absolutely. So what's much easier is to take a highly assimilated form of phospholipids. And the problem, just reiterating again, if you take it, you go to the health food store and get it, it's very poorly absorbed orally. Very, very poorly absorbed. And you notice there was two varies.
Yeah.
So by this proprietary technology, it's far beyond liposomes, which are in the fraction, you know, the millionth of a centimeter. We're talking nanotechnology, a thousandth of a millionth of a centimeter. So the absorption in ultra-absorbic C and Detox Max is very, very good. And we are seeing, I don't want to talk about claims on your program, but we are seeing some of the most dramatic turnarounds from not only doctors utilizing it, such as yourself, but also cardiologists with severe cardiovascular patients.
And, you know, and this is all natural, and not to cut you off, but Belinda, who is my co-host, actually she's not aware. I like to make people little cocktails when they come to my office with maybe some of the berries, a lot of the berries, and put it in a nice little bullet. And I have used that a lot of times when a person come in and feel a little nasally or something, and I'll mix them up as a little cocktail. And immediately they feel so much better.
You're right. In fact, what happens with the phospholipids, and the main reason, if they throw in, let's say, some ultra-absorbic C in the fruit smoothie or cocktail, is it enhances circulation all over your body, including your brain. And one of my friends, I did that at home, and he said, I don't know if this happens with everyone, but it felt like a lightning bolt went through my body.
Right.
Of course, I don't feel it because I take the ultra-absorbic C twice a day, and I get my share of phospholipids. Incidentally, you know, I travel quite a bit in teaching doctors and kind of eat in good restaurants all over. Well, my cholesterol wasn't the best. It was about 300. So I did not want to take the statin drugs because of all the side effects and potential dangers.
Right.
So I just kept on with ultra-absorbic C and occasionally Detox Max. And my cholesterol is 170 on the dot, which is quite good for my age group, the higher 60s. So I am definitely sold on this. I take no medications, not even aspirin, and to have that kind of cholesterol and triglyceride level is excellent for my age, considering, yes, I eat healthy, but, there is, my wife likes desserts, so you know how that goes.
Yes.
Absolutely.
And she says, yeah, but we'll share it, so anyway.
Well, it is a liquid, and Belinda has had it in one of the cocktails that I've made for her, so she can give you her experience on that wonderful. It was a vitamin C, Belinda, that I mixed, but I
remember that.
I mixed it with something. So yeah,
I remember that. It was so delicious. I mean, it was better than, my goodness, it was so, I tasted the berries. It was just sweet enough. I actually wanted to find out if I could have some more. Actually, it was so good.
yeah. And the one thing about this product is it's where it's not a prescription. So if you go to, a doctor who is actually utilizing the product, is something that you can easily start taking and with no side effects. We have a caller. I'm sorry.
Sure.
We have a caller. Can you state your name and where you're calling from, caller, and your question in advance? Thank you for calling.
Thank you. My name is Kayla, and I'm calling from the high desert. I just want to know, is there a particular lab test or an assessment that should be done or can be done to determine a deficiency, I guess, in phospholipids? And then the ultimate question is, how do I determine what phospholipids I need and how much?
Well, the most predominant phospholipid beneficial, other than neurological problems, is phosphatidylcholine, and we really can't get enough. There has been studies by Rome Poulenc, which is a major pharmaceutical and chemical company in Europe. There is no known toxicity, even exceeding 20 kilos for an average human of, say, 140 pounds or 150 pounds. 20 kilos, that's
75%
one heck of a lot of weight. That's 48 pounds at one, per day. So there's no known toxicity. What's interesting with phosphatidylcholine, and it's kind of technical, I just want to add documentation to this because I mentioned it's useful for, our blood vessel system, and we have hundreds of thousands of miles of blood vessels, including capillaries in our body. There's an enzyme called LCAT, and it's kind of technical, but it's lecithin cholesterol acetyltransferase that causes phosphatidylcholine to bind with cholesterol and pull it out as a water-soluble substance called an ester. So, in essence, where does the excess cholesterol come from? Your blood vessels is the immediate, that's the stuff in the blockage in your blood vessels or coating, and also many people have fatty livers. So in using phospholipid therapies, sometimes the cholesterol and or triglycerides and or bad cholesterol, VLDL and LDL, may rise, but it's water soluble. It is disposed of through the liver and kidneys and bowel movement. So it's safe. It doesn't redeposit. And then as you lower that, what is called metastatic levels of cholesterol and triglycerides in your body, then your cholesterol and triglycerides drop dramatically, like mine. Mine dropped 130 points.
That's amazing. So it doesn't act as a fat-soluble vitamin?
No.
No.
Okay. Okay, awesome. So my following question would be, where do I get it? And can I order it through NutriMed, Dr. Lee?
Yes, you can.
Yeah, they stock it.
Yeah, we stock it here, thanks to my wonderful associate on the call with us. And
now, honestly, does it have like a cod liver oily thick consistency?
It's thick, but when you mix it with juice or smoothie, it actually makes the juice or smoothie more creamy tasting.
It does.
Okay.
Yummy.
Well, I'm going to have to try it. I really appreciate it. Yeah, I was just concerned about if it acted as a fat-soluble vitamin, which can become toxic to the human body. But just to know that when it metabolizes, it exits the body as like a water-soluble substance. That's awesome.
It has better absorption than water-soluble B vitamins, and it has no known toxicity according to CDC data, Center for Disease Control. Also, phase 1, 2, and 3 studies on it.
Okay.
This has been around for over 60 years.
Awesome, because, I don't do soy products at all, organic or not. My only concern with soy is it metabolizing to estrogen. So I don't do...
There is no isoflavones. There is no component in this is phosphatidylcholine.
Correct.
And what's important is to get it very pure, pharmaceutical purity, and that's what we do.
And let me just ask something too. You asked about lab tests directly with phospholipid, but if you want to know the lining of your arteries and different things, how healthy you are, you want to do what is a C-reactive protein. So C-reactive protein will let you know about inflammation. They can lead to a lot of other problems too. So blood test is always important as to look at. And then along with your lipid panel, which is that, your cholesterol, your triglyceride, your good fat, your bad fat, your LDL, your HDL, and then your very, very low density fat, which is your VLDL. And so those tests are really important. They're valuable tests to look at. And I thank you so much for the call.
Because I know when I initially came to see you, you did this micronutrient testing, and we were unclear about a lot of things. I know now we have a handle on how much vitamin D I'm supposed to be taking, D vitamins, and it was really helpful because I thought my one-a-day vitamin was doing it. And it just wasn't. So you really educated me on whole food supplements. I mean, you really have educated me along the way. And I guess I'll schedule another appointment to come in to make sure I'm properly assessed when I'm taking the supplements.
Oh, thank you very much. And thank you so much for calling in. It'd be great to see you again as soon as possible here. Thank you.
Well, it's a pleasure to have individuals like you on the airway to provide this type of knowledge. Dr. Takemoto, correct?
Yes, well, thank you very much.
You guys have a blessed and wonderful day.
Thank you.
Bye-bye.
Bye-bye.
And we have a listener who's just written in a very interesting question here that I'll just pose it here for both of you. It says, Dear Dr. Lee and Dr. Takemoto, I take krill oil capsules on a daily basis. A friend of mine told me about these capsules, that they're very healthy for us. Is it a source of phospholipids?
To answer your question, there's very little in krill oil. It's a good source of EPA, principally EPA, not DHA, in most instances. That's number one. And also, what we have found that, unfortunately, krill oil, even though it's from a microorganism in the ocean, we've seen there's mercury in there. And a better overall source, this is my opinion now, of EPA and DHA is you get a extremely high-grade EPA DHA obtained from small fish, and it has to go through molecular distillation. So the EPA DHA that we have manufactured for us goes through this 3-stage molecular distillation, and it tastes good, it doesn't taste fishy, and it's got traces of orange flavoring in it. So I take it twice a day. And it's really important. I know there's a big workup on krill oil, but many times the krill oil manufacturers are not backing up levels, especially of mercury. And that's very critical.
Sense. Yes.
Yeah, very critical. And now since they're dumping the mercury, I think now from the dental into our ocean water now too, because now legally they're, I guess, removing more mercury, dental amalgams and mercury, and it's going into our water system.
I know.
Absolutely amazing.
So, and one other question that I had for you on it was a phospholipid. Kind of slipped my mind. But we know cardiovascular-wise, it's excellent for. As far as a maintenance, or you don't really have to have a problem, I'm seeing, because of our air pollution and everything's so polluted. But in order for a person just to stay healthy, what dosage would you say, Dr. Takemoto, it would be good for just a maintenance dose for a person to do this on a daily basis, or maybe a couple times per week?
Well, if you look at the studies in Europe, they used as little as 2 grams of essential phospholipids, but it was intravenous, and according to the studies, it basically reversed heart disease. So what I take personally myself is about 1 teaspoon of ultra-absorbic C twice a day. And I don't know exactly how many grams or milligrams is in there. I also occasionally take Detox Max Plus. Detox Max Plus is loaded with phospholipids.
Yes.
So there is well over 20 grams in a small bottle. And so if you look at the studies with as little as 2 grams or even 0.2 of a gram, what it does in your body, and these are people who eat fairly healthy, and they did a placebo. So we're not getting enough phospholipids in our diet. That's probably the bottom line.
Yes. Well,
and if you go to the health food store and you get it, it's probably not this nanosphere microencapsulated form of phospholipids. And so you're not getting the assimilation. You basically have more expensive bowel movement, in a nutshell.
Yeah, you're just pooping it out. And also on the phospholipid, and good for Alzheimer and dementia, it's one. But the Detox Max, when I've done hair analysis, has been really good. But I just wanted to share, I have a patient, including my grandfather, who is 99 years old now, who's been on some of the products here also. And he's 99 and he's still doing well. Matter of fact, he said he's in the process of getting married again. Yeah.
Wow.
But I do have a patient who is 97, 98, and she started with me about 7 years ago, had a mild stroke and heart disease and you name it. And I'm telling you, this lady is incredible. Her doctors they told her she only had 20% functioning of her heart. And now she's doing phenomenal. Matter of fact, she still works. She's still working. She has like 40 employees, and she is 90, and she's 98 years old with 40 employees, still doing well.
That is so inspiring. I love it.
I'm going to have her on the show one day. She is an inspiring
Absolutely.
woman.
Well, if it wasn't for the products that you have advocated for her, I seriously doubt she is able to manage that many employees at her age.
Yeah, and remembers everybody's names, and she even remembers their family names. Can you believe this?
That's incredible for that kind of age.
Yes. I'm definitely going to have her on the show here really soon. She's an incredible lady. And such a incentive for other people.
Yes.
And I just want to say, if you just tuned in, you're listening to the Cherilyn Lee Health Show with my co-host here, Belinda Foster, who's also my publicist, and your host, Dr. Cherilyn Lee. And I want to thank you for listening in, and we still have about 26 minutes or less to go. So if you have any questions, please do not hesitate to call in. If you have a question, or you can email us. I'm sorry, I don't have the number in front of me. But you can email us at INNER, light, LIGHT, radio, at yahoo.com for any of your questions there. So if you're sitting at work, because I know a lot of people text me while I'm doing the show on my phone because they are at work, but you can also text us or email us on the show here. But if you want to call in on the show, it's area code 310. Give me one moment here.
I'll hear it right here. It's 310-928-7733.
Thank you so much, Belinda.
You are so welcome, Cherilyn. Absolutely. And I just want to say this is so educational, enlightening, and very interesting, this conversation we're having today, because, to understand the significance of phospholipids in a healthy diet and in health maintenance is, I would say, it's so important because of all of the wonderful benefits that we can actually experience from the intake of phospholipids. And am I correct in understanding that phospholipids essentially help to maintain healthy cells and cell growth and that sort of thing?
Absolutely, and also your whole blood vessel system, including coronary arteries in your heart and including capillaries and arteries in your brain.
And in your eyes. And in your eyes.
And in your eyes.
Mm-hmm.
And
wow.
And also there's part of the 900 plus human studies, published studies in Europe. It also helps rebuild organs, especially kidneys and liver, and it is really important for diabetics. I can't stress enough. I mean, type 2 diabetes now is the fastest growing non-communicable fatal disease in the United States. And we're not getting enough phospholipids in our diet. So it is crucial, to get that. And unfortunately, the sources now can be, somewhat polluted with this GMO. Mm-hmm. So the key is to get a source orally that can be assimilated, because even the phospholipids in food don't assimilate well to the bloodstream. They have problems bridging the gastrointestinal or intestinal blood barrier. So that's why it's critical to get a special assimilated form. And the majority of the studies in Europe were done IVs, because they know if you do it orally, it's not absorbed virtually at all. So that's what's exciting, is Nutrimed carries those two products that have that level of assimilation and so many other health benefits. And I know on the website it included the immune system, but I can't stress enough, if you have very high integrity cells, not only white blood cells, your immune system, and neutrocytes and monocytes, etc., but also healthy cells to keep them more healthy.
Yes.
It really helps prevent getting more serious diseases.
And that's what we want. Instead of saying anti-aging, we could say gracefully aging instead of anti-aging.
I like that. I like it.
Gracefully aging. And we want to stay as healthy as possible, because even with enzymes, we know as we grow older, after we reach the age of 20, we start losing a lot of these wonderful enzymes. So guess what else is happening in the body? So a lot of times we need to add, because a lot of people who are vegan or just eating vegetables think that they're getting enough, but unfortunately sometimes it just quite isn't enough because of the environment. It's so polluted.
Yes.
And not only the environment, you walk into a store or any place in a public place and people are coughing all over you. And so we just have to be very careful with ourselves and utilize prevention. I like the fact that you could take this product when you're feeling great and stay feeling wonderful, and take it maybe once every other day or a couple of times a week.
Right.
when you're feeling good. Because everyone that comes to NutriMed Integrative Healthcare Clinic, no one really have had pneumonia. No one have had the flu. They have maybe caught a light cold, especially ones traveling and plane-wise, a light cold, but no one has been bedridden with pneumonia or hospitalized with pneumonia, or even even mild bronchitis, as long as they continue. Right. And if they do get a little something, they're able to fight it and bounce back real fast. And that's what we want. We want our morbidity to be shortened, and that's bedridden. The morbidity level to be something that's not going to keep you in bed for days and days and weeks. So it's so important, if you're eating well, number one, eat as well as you can, and then, the supplements on the side, and take things that actually are working in the body. And it's like Dr. Takemoto said, you don't want to have expensive poop, and you don't want to have expensive urine, because that's where it's going to be all in the toilet.
Absolutely. And we have another.
Right.
We have another caller, actually a listener who's just sent an email here, and says, "Thank you so much for such a wonderful show today, as always. I have a general question. Do phospholipids assist in the absorption of vitamin C?"
Ultra-absorbing C is true non-corn, and 99.999% of vitamin C is GMO corn-derived, with associated problems. We talked about it in previous shows from Dr. Lee. As ultra-absorbing C, the absorption is mind-boggling. Pardon the expression. It is, because normal vitamin C orally, whether it's a powder, capsules, tablet, not even including about the GMO problem of the raw material, but it's only 2 to 5% absorbed. And if you're a 22-year-old healthy male with no gastrointestinal problems, etc., it's 9% absorbed. So what you take orally, not much of it goes in your bloodstream, and it becomes more expensive bowel movement. In fact, some people can take 1,000 milligrams of vitamin C they get from their health food store, and they could get diarrhea or real soft stools within 2 or 3 hours. We have doctors utilizing ultra-absorbing C in cancer programs, and they're taking 20,000 to 30,000 milligrams a day with no stool problem.
Exactly. And this is by mouth. This is by mouth. This is not an IV.
Right.
Exactly.
It also, and we have some data to support it, when it's mixed with other supplements or food, it tends to enhance assimilation of the vitamins and organically bound minerals that are in the food or supplement. So it has some additional benefits. It acts like a carrier. And that's what's really exciting. And we've seen clinical results.
That's very
that's
exciting.
Wonderful. Yeah, it is absolutely wonderful. So what would you say, I kind of know, but how young can a person be? Is this okay for a child? And I know we've had this discussion before, but I just want the audience to know. So what is the age, how young can a person be to actually be on the Ultra C or the Detox Max? Before you answer that question, if you could just hold your thought on that question, because we do have a caller. Caller, can you state your name and where you're calling from and your question? Thank you for calling. We do have a caller. Okay. Maybe there's a little technical difficulties on that line with the caller. Okay, Dr. Takemoto, if you can answer that question, please.
Well,
sorry.
my wife's cousin is a newborn baby, probably about a month old, and developed a upper respiratory infection, and the ultra-absorbic C greatly helped. It was put in the breast milk in a bottle.
Oh, my.
So it has no known toxicity. We've even had animals with some very serious immune problems, and either the owner and or veterinarian utilized and reversed a very serious fatal health problem that they had. So even in animals, it's beneficial, let alone humans. And my mother at 96 takes it. So at the upper extreme age.
96 years old. That's just fantastic.
Oh, my goodness.
That is amazing.
So we do have our caller here. I'm so sorry. And you can hold that just a moment again, Doctor. We have a caller. State your name and where you're calling from.
Yes, hi. I'm so sorry. I was talking away and I forgot to plug my mic up. So my name is Devanay Unleashed, and I'm loving the show. I love everything. I mean, I was really talking. I looked down. I said, "Oh," so excuse me for that. My question today is there a way, because we need to get the government involved in some of these things that could really help us as a society in our health. Is there a way that we can incorporate these this particular type of product that you're trying to tell everyone to use? Is there a way to integrate it into the foods so that we can bring it more to the families and to people that need it? Is there a way to get it into the foods?
It's going to be tough.
Yeah.
I know a friend of mine has a gourmet restaurant in Los Angeles area, and he's going to be incorporating some of our products like ultra-absorbic C and the fish oil and some other things in his dishes, in salad dressings, and he's going to advertise it as being healthy. But I think it's going to be tough, especially with government, to get this incorporated in our foods. You have to be a listener of Dr. Lee to get this kind of information and the ability to purchase these products.
Well, is there a way, another question, is there a way for some of us to perhaps grow some of these products and sell them on the open market, not even waiting for the government to approve? Because, of course, the FDA is, the GMOs and all that's going on. Is there a way for us as the society to make sure that some of these great products are incorporated?
Well, number one, they're nutraceuticals. So
right.
It's not like something you're going to grow, because it's not a pharmaceutical, it's not a medication, but it is done in a sterile environment. It's put together or manufactured. So it isn't something that we can grow from the dirt, which a lot of things are very contaminated growing from the dirt also. But this is a nutraceutical, so it comes from a very clean lab, and the lab has to be approved too. Is that correct, Doctor?
It's beyond approval. It has California, U.S. FDA drug license. It has federal drug license. It has certified organic, certified kosher, and pardon the expression, the list goes on. So it goes through the utmost scrutiny and sterility conditions, far beyond nutraceutical manufacturing.
Oh, my. Yeah. And that product you can find at NutriMed Integrated Healthcare by calling 310-419-4300.
Thank you so much.
Thank you. Thank you so much for that question. That was awesome. Devanay Unleashed. So thank you very much for calling in. And thank you so much, Dr. Takemoto, and if you could repeat that again, because a lot of times people feel, well, I'm just going to go find something and get a liquid vitamin C over the counter or go to one of these well-known health food stores and buy it. So can you explain that again? on why nutraceuticals and purchase it from a practitioner who has some history behind the product is so important, and not just picking things off a shelf and just start taking it. You really should consult with someone before you start taking a lot of things anyway. But this is natural, but the purity of it is so important. So if you can repeat that one more time, I think that was very powerful on the nutraceuticals.
Well, nutraceuticals, from a legal standpoint, do not go through even close to the same as a pharmaceutical drug. But when a plant has all these pharmaceutical licenses, they are, by law, they have to adhere to the same sterility, purity regulations imposed by both state and federal regulations for pharmaceutical drugs. Nutraceuticals could be made in your garage legally. And there's most companies with nutraceuticals do not even begin to go through the testing, let alone, the certified organic and et cetera criteria that the products go through.
Right.
So,
and this is a non-GMO. A lot of people are not aware that their vitamin C's are GMO corn-based.
Okay.
And this is a non-GMO.
You can put non-GMO after vitamin C, and that's legal. But the problem is the corn sugar source that's used to make vitamin C. And as I mentioned, 99.999 at least, maybe one more 9, vitamin C. And even if it says on the label, many times the distributor is buying GMO vitamin C and selling it to a manufacturer or a compounding pharmacy, saying it's non-corn derived, because non-corn derived vitamin C is quite expensive to buy. I know, because we buy a lot of it.
Yes.
Incidentally, I developed the first FDA-approved non-corn intravenous vitamin C in the world. And that is critical because the corn-derived worked fine for many years, but then because of GMO with corn, there's trace pesticides and herbicides, weed killers, in there, and it causes an immune dysfunction problem. And I discovered it when I had my immune clinic. So I developed this other one. And over 1 million bottles was manufactured, and it helped save many, many people's lives.
Oh, yes, I know. I started with you back then with the non-corn, and I still use a non-corn vitamin C based on the history of what you have, what I've learned from you from 20-some years ago. So, and some doctors want to argue with me and say it doesn't make a difference to use a corn-based vitamin C or non-corn, and I tell them I refuse. I remember the history of the lady that you shared with me who was going to a cancer clinic using non-corn for her cancer IVs versus the corn-based, and how it helped her to heal along with everything else she was doing. And that story, I just never forgot that story. And then she went to another clinic. Yeah, she went to another clinic, and they said they actually insured her. You had shared with me that they would use a non-corn, and they started for a short while using a non-corn, and before you know it, they started back using the corn base again. And didn't you say shortly after the lady died?
Yes, within less than a month. She went from virtually no tumor. She had metastatic breast cancer to the liver. She went utilizing the true non-corn. She had virtually no tumors in her liver, and she was out of a wheelchair, out of crutches, walking, feeling great, and the clinic compromised, thinking there was no difference. And her husband called me, and I said, go get a CAT scan, and she had 22 very significant tumors in both lobes of the liver. And she died just a few weeks less than a month, probably 2 or 3 weeks later.
That happened with a patient here. She was coming in. She was doing great, but she had such a long way to drive. I mean, she's coming in from the Bay Area, and she was actually coming. And she said, well, I'm going to find somebody near me. And the same thing happened. And do you know, her medical doctor referred her to the clinic, and because she didn't do IVs. And she started feeling bad, and all of a sudden, her doctor repeated the MRIs and everything to find out that the tumors were back. And they told her, we would use non-corn. And then when she went back and said, were you using the non-corn? Oh, no, the last month or so, no, we didn't use non-corn. We didn't think it made a difference. And I'm telling you, and the tumors are back. So aggressively, we had to do something again. And now she's doing great, but now the lungs are compromised. So.
Well, I get calls because I developed the first in the world true non-corn intravenous vitamin C. I get calls once a week or once every 2 weeks from either doctors or patients saying that IV vitamin C is not working. It's actually making the patient or themselves worse. And it's so sad. I can't begin to stress that. That's why it's important, whether it's the oral or the IV, to get it from a doctor that has true non-corn derived. And even compounding pharmacies, they don't know better. They're being misled by the distributors of the raw materials. So,
yes, indeed. We're going to be parting here, or the show will be ending in a few minutes.
What a wonderful show today. My goodness, as always. This is so informative.
And I just want to say, it has been, and thank you so much, Belinda, for saying that too, and thank you for being on board.
It's
and I just want to say that to know that you could put this and give it to the infant. And we have all these kids with the flu season right now, so they say, I don't know why we don't have a wellness season. But with all this happening, and to be able to put this in your kids' drink, I mean, your children is non-GMO. It is a food derivative. And to get your kids a lot healthier and feeling better, I think that is totally awesome. We have to do everything we can because these little people are getting very, very ill, and we have so many are in hospitals now and not recovering. I mean, we look at the statistic here recently from the news how many people have died from pneumonia. And just think if we had did something like this, that would have been could have been alleviated.
Absolutely.
We are running out of time, and we're just wrapping things up. And Dr. Takemoto, I want to thank you so much for being here on the Cherilyn Lee Health Show.
Thank you very much.
Thank you, Belinda Foster.
It's wonderful. Absolutely.
Thank you very much.
Thank you. And as I always part, I like to say, repeat after me. And thank you, too, everyone, for sending those emails. So repeat after me. I am so grateful that I am a magnet for miracles.
And we
keep things going. Blessings and peace, everyone.